Thank you so much for joining us here today on the Naturally Inspired Daily. If you aren't yet a member over on livenaturallyinspired.com, we'd love for you to join us there. All our content is there: blog posts, naturally inspired podcast clips, notifications for podcasts, and of course, these daily videos. So you can actually sign up right now for your first month free using the promo code Tammy. That's TAMMY. We are here to help people feel good so they can do what they love for longer. So let's get started with today's Health Watch tip. I want to talk today about this concept of individualized healthcare. Many people, I think, don't understand just how important it is to recognize that we are unique individuals. Therefore, they have a difficult time understanding why someone would have an adverse reaction to a medical intervention that they did totally fine with. I see this over and over online, like this is some kind of rebuttal for people that, hey, I took the shots, I'm totally fine, so you must be a liar. It's really irritating because, of course, we know that people are having adverse reactions, that people do have adverse reactions to medications. This is a hard concept for people to grasp unless it's described as like some kind of allergy, like, oh, do you have an allergy for that? No, I don't have an allergy, but I had an adverse reaction. So let's dive into it a little bit. Without getting too complicated, I just want to bring some understanding to this concept. So reading this great book, I actually finished it now. It's called The Disease Delusion, and they touched on it just a little bit. And I thought that this was a good way to present it in this kind of compartmentalized little scenario here. So there's a guy named Alan and a guy named Sue. Okay. And Sue can drink 8 cups of coffee a day and remain cool, calm, and collected. While Alan, if he drinks even 1 cup, is jumping out of his skin, right? So there's a specific CYP450 gene that detoxifies caffeine preferentially. It's the enzyme that claims caffeine. Like all enzymes in the body, its structure has been determined by the message coded for it and was locked into the genome at conception. Your genome, my genome, the genomes of Alan, the genome of Sue. Okay, so the concept here is that we all have this different genetic makeup, and this is what exposes us to being able to detoxify drugs or not be so good at detoxifying drugs. So that's the concept behind this. And let's take a look at this, if we can pull that up again, this NIH study here. So the headline is Genetic Differences in Cytochrome P450 Enzymes and Antidepressant Treatment Response. Well, when I went looking into this matter a little bit further online, I saw a ton of studies and interest in how we metabolize drugs, how we react to drugs when it comes to antidepressants. And I found that really interesting because there are a lot of studies that say, lifestyle changes, exercise, those types of things have the same, if not a better impact on mood disorders than medication. So they're looking into this. This is obviously an issue, and there is some understanding about it. But again, as we talked about yesterday on the daily, they're not asking the right questions, right? Because these studies are funded by big pharma. They're funded by people who have special interests in proving their point. They want antidepressants to work, and that's the hypothesis they're trying to prove. So we have to start asking the right questions, right? Like, how does lifestyle and habits in our nutrition affect our moods? But they're not asking that question, right? We have to ask that question. But anyways, in that study, it shows just how your genotype can impact how you take in antidepressants and what impact that will have on your symptoms. Well, the same is true with other medications. Okay. So adverse drug reactions have become an increasingly common and increasingly scary healthcare phenomenon. Like we talked with Kim Witzak the other day about drug safety, and that is what she does as she sits on that FDA panel. She is there to advocate for patients that have been harmed by adverse drug reactions. This is scary enough to contemplate that the estimated 6.7% of hospitalized patients who suffer a serious adverse drug reaction to medications that are correctly administered by trained medical professionals. Let's say that again, correctly administered. Okay. So this isn't people taking them, willy-nilly and screwing up the dosage or whatever. These are drug reactions happening for people who are taking drugs that are, prescribed in the manner that they are prescribed. Okay. So that's not like they're doing something wrong. Some adverse drug reactions, in fact, occur from the use of over-the-counter, non-steroidal and anti-inflammatories, NSAIDs. These NSAIDs, guys, they bring a lot of worry here because I see kids take them like they're candy, right? Because my kids are both athletes. I'm around other athletes, and they take these pills like it's nothing, right? They're almost preventatively taking them. Like, I don't have pain yet, but I probably will. So just in case, I'm going to take these. And there is absolutely no acknowledgement in the public sphere about adverse reactions to these just over-the-counter pain reliever type things. 36 million Americans every day without benefit of a doctor's care are taking these products. And the fact is that an individual's unique genetic makeup is so powerful in shaping his or her detoxification process that you really have no idea what these simple over-the-counter drugs may be doing to you. And again, this is from the book, The Disease Delusion, by Dr. Jeffrey Bland. And this came to my attention probably about a year and a half ago in terms of getting my own genetics done. I did a great podcast with Christy Hall, and she did my genetics for me. And I learned then that I'm actually have a few SNPs that make me more susceptible to being able to detoxify drugs, which makes a lot of sense. So my reaction to finding that information was making sure that I got all the toxins out of my cleaning products, making sure I got all the toxins out of my laundry soap, perfumes, stuff like that. That's an easy swap to make in my lifestyle now that I know that my genetics are actually, a little bit weaker when it comes to detoxifying drugs. But just having that information, I can then, build my lifestyle in a way that builds up my strength in my genes and minimizes those deficiencies that I have. Unfortunately, some platforms censor the information in this show. Watch the rest of this episode by going to naturallyinspireddaily.com. Find amazing interviews with people like David Icke, Max Egan, frontline doctors, and more at naturallyinspiredpodcast.com. Connect with me directly at tammycuthbertgarcia.com. Support our amazing team. Help us defeat censorship and become a subscriber for only $5 a month at livenaturallyinspired.com. Find me on all social media platforms at connectwithtammy.com.